Hello, friends. Welcome to Pediatric Basics. My name is Pawan Sharma, and I'm a pediatrician. So, let us talk about one of the first step uh, in the assessment of any patient, and that is history taking. It's a gold standard, but unfortunately, with our modern medicine, it seems to be losing its stream. What I would request you is please do not does this video by initial 30-second or a minute. Please watch it in full so that not only you understand what I'm trying to talk about, but also it will be helpful for your own perspective and feedback about this video. Now, what I have observed while have been on the wards, assessment of junior doctors as well as assessment of medical students, more and more there is kind of significant lapse in the history taking. What I will do is divide this video into kind of a four parts, giving four important aspects which I think, and then when you have had watched it, give your feedback about what you think about it. Okay, you can see the standard algorithm of history taking on the screen, but I think what is most important is history of presenting illness is not just noting down the details from the patient or a carer, but it is actually an elaboration that we want to assess from the history what exactly is going on. So we will have to direct patients so that we get the right information to come to a conclusion that what system is affected or what problem is going on. As a very simple example, I'll give you or tell you is that somebody presents to us with a cough. So what we need to know the onset of the cough, the duration, the severity, the diurnal variation. Are there any aggravating or relieving factors? Or are there any associated symptoms so that we can try to understand what could be the reason behind this cough, as there are many causes of cough. So this is just a short example where we should try to understand that history taking is really skillful job to try to understand what is going on. But apart from that, what you can see on the screen is fairly simple, and most of you know that, and you have been studying and reading practically everywhere in part of the history taking and assessments. Okay, so actually, I should have said 5 points. The first one we already discussed, but the next one is I think I often see the trainees and students approaching someone to find out what the diagnosis is before going and examining and assessing a patient. But this is really not good for our thought process, learning, and as well as for the patient care because the diagnosis given by somebody else could be completely different. So it is really important to know this that see, history taking and assessment is just not knowing the diagnosis, is the whole process of understanding the problem and being able to analyze and provide the necessary help to respective patient. Okay, communication. I think not many people still know that listening is one of the most important aspect of communication. So do listen to your patient what they are trying to tell you. Do listen to parents what they want to tell you. But I think equally important is it is our skill and our job to guide them appropriately so that we arrive at a conclusion about what is the problem. Parents know their child the best. So if they are raising any concern, we should be taking it very seriously. And as we say, parents are always right unless proved otherwise. Never ever forget this statement. Top of my list is with regards to history taking is observation. It is really a key and one of the most important aspect as it can give clue to many things. Number one thing I'm going to ask is the child or a person is well enough to go ahead with the history taking, and do I need to give a shout to someone else to provide any help, and then you might be saving a life. So not only that, your observation or our observation can give clue to many important findings like cyanosis, presence of any rash, any external bleeding, patient's gait, breathing difficulty, and so on and on. So you can see some of them on the list on the screen. Now, within observation, especially important from the examination point of view, is looking at the surroundings, whether are there inhalers, are there medications kept aside, is there a urine pot, and if there is a urine, what does it looks like, and is the patient on oxygen, and are there monitors? So all these things are really important. Always watch for them. Okay, so very quickly, let us just have a quick recap about what I wanted to talk. So, number one, history taking is an elaboration and not just taking down the notes. Number two is always have an unbiased approach towards the patient when you are going for an assessment. Number three is listening. Yes, very important. Number four is parents are always right unless proved otherwise. And then, as I said, top of my list is observation. A keen observation can save a life, and you might be able to assess some important aspect in terms of your findings. So, thank you so much for your valuable time for listening to this video. Please do comment, provide your feedbacks. We'll be grateful for your continuing to support our channel. Thank you so much once again, and best wishes.